would say that SI pain is one of the most common things that people come in thinking they have and they don't. This is either commonly misdiagnosed versus Dr. Google or potentially by someone else. And what I want to do today is clarify sacroiliac joint pain, true sacroiliac joint pain, versus what it most commonly actually is, the underlying root cause of the problem. So let's dive in. More than 90% of the time I see a patient in my office that thinks they have sacroiliac joint pain and indeed has pain in the SI area, which is right there. The area between the butt and the low back spine, the lumbar spine, right there in those dimples, has disc problems. Lumbar disc issues, either bulge or herniation or worse. So oftentimes, what does a sacroiliac joint diagnosis come from? Well, oftentimes it'll be diagnosed based on the location of the pain, so pain in that area, either one side or both, tenderness to palpation to that area, meaning the therapist or provider or doctor pushed on that area and asks you, does that hurt? And then you say yes, and then you have pain in your SI joint. And then worse with movement, especially with hip motion. So maybe hip flexion, maybe they'll have you move the hip either into flexion or sometimes extension, and you'll have a little bit of raise in pain there. And then oftentimes SI joint pain will not respond that great, or at least not prolonged, to injections. So cortisone injections or other. And this type of SI diagnosis is actually a misdiagnosis. More often than not, that kind of pain, that distribution you just saw on the screen, is actually an underlying lumbar disc irritation or inflammation or injury. Now that's not to say that true sacroiliac joint dysfunction doesn't exist. It indeed does. But more often than not, it's due to a traumatic injury, a car accident, something pretty significant, a fall from a height, something like that that can disrupt the ligaments in those joints. Because truthfully, the SI joints have really strong ligaments. It's very hard to actually injure that area. That doesn't mean you don't have pain there. You probably do have pain there. It's very, very common. But we need to know the source of the problem. So how do we know this is actually a disc injury or issue, not a local source in the SI joint? Well, first, let's take a look at the pain pattern and symptom of a disc problem. It's often stiff in the morning, but better a little bit as you get your day started, as you get up moving around. So that early kind of morning AM stiffness and pain, that gets better with movement. Next, you'll typically get more pain when you do lumbar flexion. So tying your shoes is difficult, putting your socks on is difficult, picking stuff off the floor is difficult, and can create lumbar back pain or low back pain. Sit to stand becomes difficult. So when you're coming from a sit position to a stand position, and you get that little bit of, oh, it's stiff, until you start walking around a little bit, and then it starts loosening up a bit. You often also have bouts of excruciating or very high low back pain that can last anywhere from 2 to 10 days, but typically actually resolves a good amount. So it kind of comes and goes like that with those big waves. Now sometimes you'll also have leg pain shooting down the leg, either numbness, tingling, or pain that goes down the leg. That's also indicative of a disc injury. That will often be paired with what's called a positive Valsalva sign, which means if you cough, sneeze, or strain, bear down, that will increase your low back pain and or leg pain. Which brings us back to the SI joint. Why does it hurt there if the pain is actually in the disc in the middle of the spine? Because there's nerves that run out of the spine that actually go to those areas in the low back, and that's actually what's causing that pain. The good news is if you get to the right practitioner and provider and they're wise enough to sort this out and differentially diagnose true SI joint pain from disc pain, if you get into a good protocol of improving and rehabbing that disc health, you can actually get better pretty quickly. In fact, in my office, we kind of have a loose 5-visit rule. If somebody's low back pain that fits that description I just went through doesn't get better in about 5 visits, then I've either missed something, we need to get them out and get some imaging. But we know that if we attack that low back with a good solid protocol of a disc issue, then they'll typically respond within 5 visits positively. If we see that improvement last, that's what we really want to see. Because a lot of times people will get an improvement in their pain right away with some sort of intervention, whether it's massage, scraping, adjustments, or otherwise, but it doesn't last. They always come right back to baseline. What we want to see is that improvement get steadily better, whether it's 10, 20, 30, or even 50% better over the course of those treatments. Once we know that that treatment is working, then we know we're on the right track to rehab that lumbar disc, and the SI joint pain will actually dissipate. Check the link in my description to find a qualified provider, and tune in next week for when I actually show you some exercises to know which way to get started on your own with some of this rehab. It's been Dr. Scott with the Full Body Fix. See you next time.